answering that question requires beginning with what do we mean by freedom and what do we mean by rights and protecting these things. When we talk about freedom, what we're talking about is the absence of any physical coercion by another human being. So we don't have other people telling us, using either fraud or force to overcome our will and coerce us to carry out their will. That's what we mean by freedom. And when we talk about rights, what we mean by rights is that we have a sphere of activity where it is wrong for someone else to introduce that sort of fraud or physical coercion in order to get us to behave the way that they want. And so what does it mean to protect these things when it comes to something like measles and public health? Well, measles, when we're talking about a dangerous and contagious disease, a virus or a bacterium, some of these little buggers can be as deadly as a bullet or a blade. Smallpox had an infection fatality rate of 30% before we eradicated it from the planet. And measles has a much smaller infection fatality rate, but it can be it's still a pretty violent bug because it can cause a lot of pain. It can cause brain swelling. There are other complications that other than death, but it does result in death in some small percentage of cases, and in a couple of cases now in Texas. So protecting our freedom is not, when it comes to these sorts of issues, it's not just about protecting our freedom from government. It's also about protecting us from literal physical assaults by people who are maybe unwittingly carrying a dangerous pathogen. So the balancing act that you're talking about is a balancing act is the right way to think about it.